This is Pain Diaries. Take care of you so you can take care of business. I'm Dr. Suzanne Manzi. I'm the owner of Performance Pain and Sports Medicine. Pain Diaries allows me the amazing opportunity to educate about treatment options for healing painful conditions. I really wanted to showcase the options and technologies available to those who are suffering. Today's show is going to be great. We're going to discuss what are peptides. And stay tuned as I have a few special guests sharing their stories and how they too can help. You can find me in Houston, Texas at Performance Pain and Sports Medicine and online at www.performancepain.com. Make sure you subscribe to my YouTube channel at Pain Diaries Dr. Manzi and share the show with those you love. Hello, I'm Dr. Suzanne Manzi and this is Pain Diaries. Welcome back. Now we're going to take a dive into a topic that has received a lot of buzz recently. So let's explore the world of peptides and their role in pain management. Inflammation, anti-aging, sleep, sex, skincare, and immunity. That's right, I said peptides. The question is, what are they? What are peptides and what do they do exactly? This topic is especially important for anyone who suffers from chronic pain and is looking for pain relief. And I'm excited to share my knowledge and expertise with you. In technical terms, peptides are naturally occurring molecules made of short chains of amino acids. They're the building blocks of proteins. Peptides are responsible for transmitting messages throughout the whole body. These messages can play a critical role in everything that controls our body, from regulating our hormones to controlling our immune system. And peptides can even play a role in influencing our pain levels. And that is why I'm so excited about sharing the information with you. Now, if we break that down into more simple terms, then we can say peptides are tiny little building blocks, little tiny blocks that make up proteins in the body. So let's think of these proteins like little Legos, and peptides as the individual Lego blocks. Just like how you can build many different things with Legos, the body uses different combinations of peptides to make many different proteins. These proteins then help us grow and stay strong and do lots of important jobs in our body, as if they can put the pep in our step. So if you're into superheroes, you can think of peptides like being superpowers of our bodies. Just like how superpowers all have unique special abilities, our bodies use different combinations of peptides to make different proteins that can give us these superpowers too. The superpowers help us grow tall and strong, fight off germs, and do all sorts of amazing things. It's like having a whole team of superheroes inside of you, working together to keep you healthy and strong. There are many different types of peptides, and each of these tiny superheroes are tasked with a specific function. Some of them are involved in regulating your hormones. Others play a role in controlling inflammation levels, sex hormones, and even anti-aging. There's lots of different secrets out there. And very excitingly, there are even peptides that have a direct impact on your pain levels. Did you know that insulin is considered a peptide? Even these new weight loss drugs that you might see commercials for, including Ozempic and Wegovy, also known as semaglutide, these are peptides as well. The way peptides work in your body is by transmitting messages between the cells of your body, which can help with regulating the various bodily functions. So in more simple terms, peptides are just like little messengers dashing around and helping regulate various functions in the body, including pain. It's fascinating to see how such tiny little molecules can have such a big impact on our health and well-being. So that's a brief overview of what peptides are and how they work in the body. There have been numerous studies and research papers conducted on the use of peptides for pain management, and the results are promising. In many cases, patients who have incorporated peptides into their pain management regimen have reported significant reductions in pain, reduction in inflammation, and improved quality of life. More research is currently being done in this field, and there's so much we still don't know. Think of peptide therapy like the world of cryptocurrency. It's like the Wild West right now. These little superheroes are fascinating and everybody wants to try them out, but we have to be really cautious. please do your homework when it comes to choosing a doctor and a pharmacy. Some people are buying peptides off the internet that are for lab use only. This is very dangerous. This designation, lab use only, means that a peptide is intended to be used only in the laboratory and is definitely not intended for use by humans. This is a warning that this peptide is not approved by any regulatory agency for the use as a drug or a dietary supplement and should only be used in a controlled research environment. Easily stated, lab use only means we as humans should not be injecting or taking these products unless we are controlled subjects in a lab. I don't think anyone watching or listening is actually a lab rat, so please be cautious. There are standards in the world of pharmacies. Please do your research if you do decide you want to start using peptides. There's an art and science behind this field, and not all pharmacies are created equally. Please ensure the peptide you may want to try is made for human use only. Because most peptides are already naturally occurring in the body, there are minimal side effects associated with peptide therapy. Unlike some traditional treatments, peptides do not have a significant impact on the liver or kidneys and are generally well tolerated by patients. The most common side effect is an allergic reaction at the actual site of injection. So that's all I have to say about peptides today. I just wanted to introduce them, let you all know that this is an alternative therapy that could potentially be beneficial to health and wellness. Research is ongoing, but there are peptides available, all of which require a prescription. Please make sure you do your homework and choose wisely to ensure the peptide you choose is for human use. We all want to put our internal superheroes to work. It's just important to do it safely. Dr. Manzi here with Performance Pain and Sports Medicine in Houston, Texas, and this is Pain Diaries. Take care of you so you can take care of business. Welcome back to Now Media TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We are back with Dr. Terry Ann Samuels, a urogynecologist here in Houston, Texas.
Oh, thank you so much for having me, Dr. Manzi.
Oh, you're welcome. As you know, Pain Diaries is here to help people understand the options that are available for treatment. So many amazing new technologies available. And today we have Dr. Terry Ann Samuels here to discuss everything about urogynecology.
Oh my gosh. Not enough hours in the day.
There are not. So you completed your obstetrics and gynecology training originally, right? And so I'll let you elaborate more on your training and how you became a urogynecologist and kind of what all that entails.
Okay. So urogynecology was kind of born out of, initially out of OBGYN. You actually can get into it through urology. And I think it came from the fact that, permission to speak openly is that we women have 3 holes, right? Front, middle, back. So the front used to be handled by the urologist, middle by the gynecologist, and the back by the colorectal surgeon. And so rather than them going to 3 different physicians, we just kind of made it one. And so we do pelvic floor and all that entails.
That's amazing. So it's all about, one-stop shop.
One-stop shop.
For the female plumbing.
That's right. The quarterback.
The quarterback.
Yeah. If you go higher, we throw it out.
So I've known Dr. Samuels since last year, and we definitely have a lot in common. Always looking for better ways to treat our patients for functionality. So
Always.
Tell me about some of the tips and tricks, as a urogynecologist for female to be functional in their lives.
Right. I think the biggest issue with functionality for women are the commonalities, really, right? So the things that affect our pelvic floor are obviously, the first transition is when babies, right? And once we go through that, then the next big transition is kind of menopause. And that's when we see big dips in terms of our functionality and therefore quality of life. So obviously those sets are completely different in terms of like pathologies and how we would treat them. But, and I tend to focus more on that menopausal female because I find that that's probably the most devastating in terms of just generally the pain, right? Pain diaries.
It's painful.
The lack of, right? It's painful because there's a lack of information, and it's kind of like, for a lot of women, it's like running straight into a back truck or falling off a cliff because no one talks about it. Right. And we don't know what to do about it.
And the misinformation out there is astounding at how people are suffering with the brain fog, the hot flashes, just feeling terrible.
That's right.
And they think, if they get their hormones fixed, they're going to get cancer.
Right.
And it's so backwards right now, and it's still educating and educating and educating. So
speaking over and over and over.
Yeah, one person at a time, and that's part of why I wanted to do this show, to really educate people about what's available for the painful conditions of life.
Absolutely.
And so let's talk more about menopause.
Yes. So, it's a time when your period stops, and that's how we usually categorize it. But it's much, much more than that, and it's a whole constellation of symptoms, and they evolve, and there's that deterioration over sometimes a 10-year period. And it's kind of hard. The best predictor of how long your menopausal change will take is usually how long it took for your mom. The difficulty is that most of us don't speak to that generation about such things, so we kind of are going into it blind. And it really is the lack of estrogen, progesterone, and testosterone, which is huge in terms, and because that's taken away, then as messengers, as peptides, they don't tell our body to do what they normally do, and any organ with receptors is going to suffer. So I always tell my patients, I was like, they always, they talk about the different symptoms, and one of their main symptoms is vaginal dryness, and it makes sense because in the vagina, it has the most estrogen receptors, right? So it's going to deteriorate the quickest.
Right. And from my standpoint as a pain doctor, I see all of the pains associated with menopause. People start breaking things because of osteoporosis, which is directly related to the hormone levels.
Absolutely.
And their bones are just being broken down because their body is breaking down.
Absolutely.
And it's again, educating people of they don't have to live like this, they don't have to feel these things. You mentioned vaginal rejuvenation because, again, it suffers because the hormone levels go down.
Right.
What do you do for that?
Ooh, fun topic. So, rejuvenation was just a coined term, and it kind of just caught because it just sounds acceptable. But really what it is we want to bring back some youthfulness and in the spirit of functionality, right? That's the main purpose, to make it functional again, and that function deteriorates because of the lack of hormones.
Right.
The problem is that function deteriorates faster because it has the most estrogen receptors. So when we talk about bringing back that youthfulness, the only way to catch up is to build new tissue. So all the different options we have and the energies we use, it's really about poking holes. Think of it like a garden, and you want to aerate. So you poke holes in the garden and you grow new shoots. It's the same thing with the vagina. So we're going to poke holes using different energies, right? And then we're going to grow new tissue. That tissue is going to be the same as the surrounding tissue, but better functioning, right? So it's going to be more sensitive. It's going to be more moist. It's going to be more elastic. So it's going to help in terms of sexuality and general feeling.
Wow.
Yeah.
Very simple.
Very simple. Absolutely.
Do you use lasers for this?
So we use lasers. We can use lasers. We use radio frequency. Sometimes there's some surgery involved.
Okay.
So all of the above, and everybody is going to be so different, right? Like this kind of care is extremely personalized. So it's very hard for one girlfriend to talk to another because coming out of the office, your prescriptions can be totally different, even though the problems sound the same.
Okay, so that's why we need an expert like you to do an assessment and a history and a physical exam and all these things.
It's a good place to start.
It's a great place to start.
It's a good place to start. The other portion, the other side effect. So what happened is when vaginal rejuvenation came out, what they started to see were these women were not leaking as much.
Oh, okay.
So this was the byproduct of the rejuvenation, and the urethra has estrogen receptors, right? So people will find not that it's necessarily a cause of incontinence, menopause, but they'll see a steep deterioration as the hormones drop.
And the urethra is where we emit
where
our
you
urine,
pee.
where we pee, right?
Hole number one.
The hole in the front.
On the front.
Okay. So let's talk a little bit more about incontinence. And obviously you say, replacing some of the hormones and getting those estrogen receptors back in action can help with urinary incontinence.
Absolutely.
What else do you do for that?
So there are different. First thing is that, again, evaluation is everything because there are different types of incontinence. So there is stress incontinence, overactive bladder, there's neurogenic. So it's important to get categorized first, and then the treatment algorithm to follow. Okay. But the great thing now is that we have so many non-invasive ways that we can treat urinary incontinence that didn't exist even 5 years ago, that it's you no longer have to wait until you're flooding a diaper to get treatment, right? Now
Right.
we catch these. We want to catch this stuff earlier, so we don't have to do as much.
Okay. And I know a lot of people talk about bladder slings and those kind of things. Is that part of the treatment for your incontinence?
Absolutely. So that mesh that everybody hears about. Now, mesh in the right hands is awesome, but it has to be in the right hands and for the right patient.
Right.
And again, that evaluation is everything, because we do have minimally invasive things, but that's not going to work for everyone, and that's why you need to be evaluated. You don't want to go through that, waste your money, and realize years later that something more invasive is more appropriate.
No, absolutely. So tell me a little more of, when should a patient come to actually see you? What would trigger somebody to come into your office?
Okay. So, God, which hole? In the front. Okay. So from an incontinence perspective,
front to back.
Okay. So from an incontinence, I always say, come in when your incontinence is changing your life. Okay. So for instance, for overactive bladder, if you've memorized every bathroom in a half-mile radius from your house, that's abnormal. Right?
Yeah.
Your bladder is now running your life, right?
That's a problem.
It's a problem.
Because it's normally a subconscious thing, and now it's become conscious.
Right.
Therefore, problem.
For your stress incontinence, right? That's the leak, right? That you want, for the most common scenario is a patient will start saying, well, I'm working out and I'm leaking, so now I'm wearing a pad. Okay, I'm leaking more. Now I can't wear anything but the black yoga pant.
Oh.
Because if I wear the pink one, then it'll show. Your bladder again is controlling your life.
Right.
That small little leak has huge implications, because now you're not working out anymore. Now your cardiovascular health. Now you're going to get osteoporosis. So right, it's not as small as that leak is. It leads to much bigger problems. So you should get checked.
Middle hole.
Middle. Listen, if you are not having satisfactory intercourse, you need to get checked, right? There's no reason that having intercourse should feel like shards of glass for anybody, not in 2023, unacceptable.
Right.
And obviously for other things, GYN-wise, heavy periods, if, you should always get your pap smear.
Every year.
So those are the biggies in terms of our office. And then obviously labiaplasty, if cosmetically, right, you're feeling that your vagina doesn't look the way it used to look, or the way it looks now weighs in on your confidence, then it is time for an evaluation. Okay.
That's great advice.
Yeah. And then at the back, fecal incontinence is much more common than we think. These women, it starts out usually as fecal urgency. So they start, because the muscle, it usually can be initiated, typically with a really bad delivery, forceps, vacuum delivery. And so the muscles have been compromised early in life, and as we go through menopause, they become more compromised because they're not exercised. Then these women are not holding their poop, right?
Yeah.
And now they compensate, they wear pads, etc. But that starts out often what we call anal incontinence, which is I'm carelessly whispering. I'm not holding my gas like I used to, right? And so it's starting to change your life in terms of what you do. You don't want to go to a library. You know what I mean? Right?
But the bus station's okay.
Right, exactly. So you're making decisions based on your function, right?
Time to go see Dr. Samuels.
Time to go get it fixed.
Okay. Well, we really appreciate all this great advice.
No, thanks for having me.
Absolutely. All this education that you're able to provide, because again, we want people to be functional. Yeah. We don't want, nobody should have to live with these little things that people are afraid to talk about. And so, Dr. Samuels, we greatly appreciate you being on today's show. If you are a loved one suffering, please know there are options. Find your nearest expert in the field. See if you're a candidate for amazing medical technologies, which can change life for the better.
Thank you.
This is Dr. Suzanne Manzi. This is Pain Diaries, and we'll be back. Welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine here in Houston, Texas. I am pleased to introduce my guest and friend, Dr. Terry Alani, the Texas Tooth Lady.
That's me. Thank you for having me.
Absolutely. Tell us a little bit about your practice.
So I am a general dentist with a special interest in cosmetic dentistry. I've been practicing for let's say a long enough time. How does that sound?
Perfect.
Quite a few years, and my practice is in the Galleria, and I treat all types of patients. Really more of an adult-based practice.
Okay.
And I'm known as the Texas Tooth Lady.
That's an awesome designation. Who named you that?
I did.
Oh, okay.
Yeah, I thought, how am I going to brand myself? And I just like that name. I'm a lady, and I do teeth, and I live in Texas. Texas Tooth Lady.
Absolutely. That's perfect. So one of the top reasons people visit their dentist is for pain in the tooth and gums.
Unfortunately, it should be more preventive, right? They should be going in like twice a year, sometimes more than that, to get their teeth cleaned. But a lot of times we do see emergencies. And one of the main emergencies that we see are for abscesses.
Ooh.
So basically, if you have pain in your tooth, an abscess can be from a tooth that needs a root canal due to a lot of decay, right?
Okay.
You have let that go. You haven't seen your dentist twice a year that you should. Another reason would be an impacted wisdom tooth. A lot of people do need to get their wisdom teeth out. Another reason would be a tooth that is broken and it is abscessed, or maybe gum disease. So there's a lot of different reasons, and you do not want to let that go, because you know that bacteria can pass through your heart and cause a major infection. So you want to make sure you get that taken care of immediately when you start to feel that.
Right, that's dangerous.
Exactly. So basically, dentistry, we always say, is not expensive. Neglect is, because we try to really encourage our patients to see us on a regular basis so they can prevent this kind of thing.
Yeah, I know. I mean, I've been going to the dentist before I lived in Texas. I mean, I went for years and years, even as a child, because my parents instilled that in me.
Exactly.
And I feel like a lot of people don't do that. And so when I hear that people don't, oh my goodness.
I think they're afraid, Dr. Manthi, I think they're afraid of the cost. And what they don't realize is a basic cleaning and x-rays is really inexpensive. Where you get into your expense is really when you're going into the more comprehensive treatment. And the cosmetic dentistry. Cosmetic dentistry, of course, is elective, and it can be somewhat expensive.
That's true.
So the other thing is, if you are clenching and grinding, that can also cause sensitivity. And what people are not aware of is that we can actually put Botox in your masseter muscle. It can last about 3 or 4 months, and that can help alleviate the symptoms of clenching and grinding, because with clenching and grinding you can cause recession at your gum line, which can be painful as well. So we do Botox, which people are not aware of. It's more therapeutic. Of course, you know, we can do it here and here as well. But that's one of the other things that we do treat for pain. And another thing that we do treat is for gum disease. A lot of Americans, believe it or not, over 35, there's like 35% have gum disease. Now, a lot of it is just gingivitis. So that's for the young people that might not go in frequently to get their teeth taken care of. But with gingivitis, that's very treatable, just getting your teeth cleaned. But for gum disease and bone loss, there are therapeutic measures that do not require surgery, and then of course there are measures that require surgery. So you want to make sure that you catch it early so that you do not have to go into implants or dentures.
I can imagine that would be even more costly and more painful. So obviously tooth care is so important from the very beginning stages.
And here's the other thing I want to mention. Everyone's afraid of the dentist, right? Everybody hates the dentist, but everyone needs the dentist. Nowadays, if I have a patient that comes into my practice and they have a lot of tattoos, I tell them they are not allowed to be afraid of shots, right?
I say the same thing.
There's no way. They cannot be afraid of shots, but we are very gentle, and actually people are amazed that the injections just don't hurt anymore. So don't make that a reason that you do not come in to see us. And something else I wanted to talk about is brushing. So when do you think you should brush your teeth?
After you eat.
No. You should brush your teeth first thing in the morning. You have to wait 30 minutes till you eat. And do you know why?
I don't.
So you're supposed to eat first, then wait 30 minutes, because when you eat, coffee, most of your breakfast have a lot of acid in them.
Okay.
So you need to have the saliva neutralize the acid. So that takes 30 minutes, and then you brush your teeth.
Oh.
So if you're going to brush in the morning, you'll brush in the morning before you drink your coffee and all of that. And if you are eating and you just want to brush, do water. Use water and then wait 30 minutes, and that's going to help protect. The other thing is, when do you floss, before or after you brush?
I usually floss before I brush.
Before you brush, because what you want to do is you want to get all of the debris out first, right?
Yeah.
And then brush. And I recommend those little soft picks that you can actually put into like a little mouthwash, not directly in the bottle, but you'll take the mouthwash, pour it into a cup. You'll put the little, like they're rubbery toothpicks, you can get them over the counter,
Right.
and put them in between your teeth. And that's a really great way to maintain your oral health.
That's great advice.
Yes.
Everybody
yes.
needs to know that. That's
Yes.
definitely not common knowledge.
No, there's a lot of things that we do. Now let's talk about what happens if you knocked a tooth out.
Yeah, that's, I mean, must be very painful depending on how high up. And if a nerve is exposed, I mean, nerve pain is the worst pain anybody can suffer from.
So what happens is, so being in my neighborhood, known as the neighborhood dentist, all of the kids, when my kids were growing up, would come to my house because they'd have a tooth knocked out with a baseball, they'd have a tooth knocked out playing football. And here's what you do. You have 60 minutes. 60 minutes to reimplant the tooth to make sure that that tooth might be vital
That's
again.
not very much time.
So you want to make sure that you keep your, you hold it by the crown of the tooth, which is the part that you see when you smile.
Okay.
Keep your hands away from the root because that's where all the nerve endings are. Don't wipe it with fabric, cloth, or anything. You want to rinse it with milk or water, or you could actually put it in milk until you get to the dentist. Now, here's something very interesting. If you have a child and it's the child whose tooth has been knocked out, what you want to do is you want to take that tooth after you've rinsed it and you want to put it in your mouth in between your cheek and your gums.
So the parent's cheek.
Parent's
the
cheek
child's
or
tooth that
gums,
was
yes,
knocked out.
that's going to keep
Okay.
it moist and that's going to keep it
The saliva.
saliva,
on it.
yes.
Okay.
Now, if that's not possible, then your child can spit into a cup with their saliva and you put the tooth in that saliva
That makes
until you get
sense.
to the dentist. And then actually, you know, we've done a lot of reimplantations of teeth. You can go to the dentist, we'll splint it. They might need a root canal, but you can save the tooth.
Okay.
Wear a mouth guard, athletic mouth guard. That will help
That
prevent
helps
a lot. Yes.
Yeah. I'll be
So
bringing my
so-
kids to your house.
Yes,
when they're
yes.
old enough to knock their teeth out.
I'm a neighborhood dentist. I actually enjoy it. You know, I go out and people ask me questions all the time. They think they're bothering me. They probably do it with you as
of
well.
course. But
I
it's
mean,
not.
I did it with you with my son.
I
Remember?
love it though. I mean, it's,
Remember?
I do.
Yeah, and we like it,
We
right?
like it.
Yeah, they'll go,
Yeah.
I hate to bother you.
But you're
And I'll go,
not.
no. The only thing I don't like is if I'm out to dinner and a patient or someone knows that I'm a dentist, they come to me and they actually take their fingers and put them in their mouth and they separate their teeth and want me to look at something. That's that's
No,
gross.
not
That's
at dinner.
embarrassing. Yeah. So.
I don't get that because people can't really show me their pain.
No, but you know, like if I promise you, if you're under your pain management, first thing I'm going to ask you is what do I do with my shoulder? What do I do with
Right.
this? Yeah. So as a dentist, it's mainly just confined to the
Exactly.
mouth. But the other thing is, let's talk about whitening your teeth.
Yeah. So I have very sensitive teeth. I don't want to whiten my teeth because of that.
Exactly. And so whitening products have ingredients that can really cause sensitivity. So there are a lot of people that are overusing whitening. They're whitening almost every
Ooh.
day, which is super unhealthy for your teeth. But I will tell you, there is a toothpaste, it's prescription, called Prevident. And if you use that toothpaste before you whiten, it helps neutralize these dental tubules, and so it helps reduce the sensitivity.
Oh, that's nice to know.
So that's something also that you can do to help prevent sensitivity in your teeth. And another thing that we do is sometimes clenching and grinding can cause a lot of soreness, and I was saying with Botox, but wearing a night guard at night is going to help
Right.
that as well. But also getting your bite adjusted. Sometimes it might require Invisalign, sometimes it might require just adjusting the bite with minor adjustments, and that will help as well. So you don't have to live with pain in your mouth.
Absolutely not. And
Yeah.
I do Botox for cervical dystonia, and a lot of it is in the temporalis and the masseter, and so I do put it in people's masseters as well. So we have that overlap.
Interesting.
But they always come back and they say, I don't really grind anymore. It helps so much. It
Yeah.
helps with my grinding.
It's
And
incredible.
it's amazing how well it works.
It's incredible. And I always tell people that if you, and let me say something else, healthy gums don't bleed. They just don't bleed. Now, one other thing that we do in our practice is that we take blood pressure readings on every patient. And I cannot tell you how many patients tell me, oh, it's just white coat syndrome, that they're afraid of the dentist. Their blood pressure is shot up, and we know 120/80 over is normal.
Is normal.
Yeah,
of course.
So their blood pressure shot up to like 190 over 105, and I'm telling them, no.
Did your white coat cause that?
Yeah, and we don't wear white. We wear black scrubs.
Right.
So that can't be it, right? But I will tell you, I tell them, if you think that you have high blood pressure, one of the things you can do is monitor your blood pressure about 3 times a day at various times for 5 days.
Okay.
And then we'll refer you to a cardiologist. So that's something else that we do as dentists. I mean, we don't just fill and drill.
Of
We do a
course.
lot of other things. There's sleep apnea, which we also diagnose,
That's great.
that has extended patients' lives by going in and getting that treated, which they don't realize.
We do the same because
Sleep
people are in
ap-
pain. They're overweight. They don't know. They snore. They wake up unrefreshed. They don't feel good. And it's like, well, are you not breathing at night? Let's check it because
Right.
this is dangerous.
They're not breathing. Another thing is they get sluggish during the day. So I'll ask patients, do you get irritable? Do you get tired during the day? The first person that I diagnosed this on was my dad. He was sitting in the reception area in my office. Yes, I treated my parents. I did all their dental work.
That's great.
And he was sitting there and he was falling asleep in the middle of the day. And I got him in the back and I go,
Yeah.
what is going on? And he snores and what have you. So we got him into a sleep clinic, and sure enough, he had sleep apnea, and he was treated with a CPAP machine. And it just extends your life because these people are prone to strokes, as you well know.
Exactly.
Yeah.
Exactly. And that's more complications and more pain and more expense.
Exactly. And now I know a lot of people don't like the CPAP machine, so there are dentists. I do not specialize in it. I have friends that do. They can have oral appliances, which is really helpful because a lot of
Right.
people just don't like wearing that machine.
Fantastic.
Yeah.
Well, I think our time is up.
Okay. Well, hopefully I got some points across for your viewers. I enjoyed being here.
I'm so happy you came to
Thank
visit us
you.
today.
Thanks.
And featured here on Pain Diaries, this is Dr. Terry Alani, your Texas Tooth Lady.
That's right.
And I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine. We'll be back after a commercial break. Hey, Dr. Manzi here, back on Pain Diaries. I'm going to ask Dana Oliva, our benefits strategist, some questions so we can really understand insurance and choosing the correct plan.
Thank you, Dr. Manzi, for having me.
Absolutely. So, Dana, first of all, how do I choose the best health plan for my family?
You know, that's actually a great question. I'd always start off by assessing the family's needs. Consider factors such as the age of the family members, their medical histories, and the type of care you're anticipating needing it for. I would also compare health plans based on the cost and coverage. Most importantly, the coverage. Paying for something that you're not getting doesn't really do you much good. So always make sure that you check exactly what the plan covers and doesn't cover. Make sure that the plan you choose fits within your budget and provides coverage for the services that your family needs. Check for additional benefits. Look for plans that offer additional benefits such as preventative care, telemedicine, vision, dental, and so forth. Investigate the customer satisfaction ratings. It's always very important. Read online reviews, customers' feedback to get a better idea of what the experience is that they've had in the past. Contact the health carrier. If you have questions you want to have clarified in details, contact the health plan provider directly to get those answers. And finally, seek professional advice. There are professionally licensed individuals within your state and available to consult with you to help identify which plan is right for you. There's typically no charge for the service, so take advantage of these individuals. They can offer you, insight to the plan that you may be considering, and review what the plan covers, and more importantly, what it doesn't cover.
Okay, wow, that's really great information to take away. But I guess the biggest question is, how much does health insurance cost?
That's another great question. And it's actually, I'm going to answer it in two parts. The cost of health insurance varies widely, and depending on the type of plan you select, the number of people covered, and the location of the policyholder, generally health insurance plans range from around $100 to $400 per individual a month, and for around $250 to $2,000 for a family, depending on the size. Now what you need to use your insurance for, okay? This is the most difficult part of the equation that often gets overlooked. What if I have a heart attack, a stroke, life-threatening cancer, or diabetes? You should ask yourself 4 questions. How have I used the coverage in the past? How do I plan on using it right now? And how do I plan on using the plan over time? And finally, how much risk am I comfortable exposing myself to? In other words, your financial responsibility should something bad happen. Okay, this is very important. This is where most people get it wrong. They usually go directly to the price, and then they kind of don't care or don't understand exactly the rest of the plan and what it does and doesn't cover. You want to make sure that, number one, your doctor is going to be in network, the facility that you've been going to for your treatment is in network as well, and to make sure that any medication that you're taking is going to be covered, and that's really important. There's nothing worse than finding an underperforming plan that'll have you stuck until open enrollment the following year. Or if it's an underwritten plan, you may have developed a pre-existing condition that will no longer allow you to switch at all. My advice, reach out to a licensed health professional. Their advice is typically free, and it's their job to look out for your best interest.
Well, there you have it. Thank you, Dana Oliva, for clarifying the ever-convoluted world of health insurance. If you or someone you love needs help, please get in touch with Dana to get your insurance needs situated.
Sure, I can be reached at 281-804-3494. I also have an email address, dana.oliva@allianceinsuregroup.com. And my website, www.allianceinsuregroup.com as well.
I'd like to welcome a special thank you to our guests on today's episode of Pain Diaries. What a great episode discussing peptides, urogynecology, dentistry with the Texas Tooth Lady, and insurance benefits. As you know, I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine. Remember, you can find me at 4126 Southwest Freeway on Suite 1700 in the T-Mobile Tower on the feeder of Highway 59 in Houston, Texas, or on Main Street in League City, Texas. Make sure you subscribe on my YouTube channel to Pain Diaries Dr. Manzi, Pain Diaries DRMANZI, to catch all my shorts and episodes bringing you all things pain-related and educational information on the newest and best technologies out there to make your life better. Remember, this is Pain Diaries. Take care of you so you can take care of business.
This has been a Now Media Television feature presentation. All rights reserved.